Have you ever heard the term, your eyes are your expressions, the windows to your soul? But when your eyelids look tired and they start to sag, it will make you look much older than you actually are. There is a simple surgical procedure called a blepharoplasty or eyelid tuck, which can help to rejuvenate and redefine the contours around your eyelids. It will even improve your fields of vision, and a portion may even be covered by insurance. We can help redefine how others see you.
Well, hi everyone, I'm Judy Elliott and welcome again to North Georgia Television, and we are spending some time again today at Dalton Plastic Surgery and Dermatology, and with me today is Dr. Mary Beth Cole. Thank you so much, Dr. Cole.
Thank you.
For being with us.
It's been a while. Pleasure. It has been a while, and it's always so nice to visit with you.
Right. I wanted to talk with you and spend a few minutes with you today to talk about some of the things that I hear women talk about, and
Sure.
that would be brown spots occurring on your hands or your face. That seems to be an issue for women as well.
It is, especially for ladies. And this time of year, I get a lot of questions about brown spots specifically on, as you said, the hands and the face. And I guess the first thing to say is that not all brown spots are the same. And so there are several things that can make a brown spot on your skin. Some of those are called seborrheic keratoses, and they're actually little age spots. And they're different from what we call a lentigo, which is a sunspot. So right now I get a lot of ladies asking about these sunspots as they've had a darker tan and that's faded away, and then what they're left with is the little dark spot that's not leaving. And there are lots of good treatment options for those.
Right.
Yeah.
Tell me what those options would be.
Sure.
I don't know if we have a lot of time to go in detail, but
they're generally topical things that can be used to bleach the area that is a sunspot. And that includes a product called hydroquinone, and it comes in several different forms. There are prescription preparations that can be obtained, and sometimes we compound those prescriptions. There's also a product line called a Baji, which you may have heard of, and we carry that here in the office, and it's a great product line. You can use it on your face. We have a kit for the neck and chest, and you can also use it on the hands, and so that's also a good option. And then there are some people who will decide to do a series of facial peels, and that's a good option as well, especially for your face, and it will help to lighten those little sunspots.
okay, well, it's great to know that we can do something
Yeah,
about
there's
it.
definitely lots of options for sure.
I want to talk also about a great event that will be coming our way
That's right.
in November. I know we're a little early talking about that, but we want to kind of get everyone kind of into the mood of knowing that this is going to be happening again. Tell me about that.
Well, we're excited to say that for the second time, we are going to be hosting an open house, which we call our Sparkle event. So we want everyone to sparkle for the holidays, and we are going to be hosting that event in November this year. So we moved it up a little bit, so everybody will be able to get ready for the holidays a little bit earlier, and we're excited about that.
Right, and also I'm sure at some point it'll be posted to the website so people can go online.
It will.
with
The
that.
exact date and time will be on our website, and you can certainly call the office at 706-226-3311.
Okay, all right. Now also, but look at more to come, because we will be announcing that. That'll be in multiple medias when that date will be.
Definitely, definitely.
Yeah.
And we have a lot of good information that night. It's our open house. We have door prizes. We have representatives from the companies here for the products that we supply. They're able to talk to patients, and we usually have some nice specials to offer that night as well. So it's a great time to come out and meet our staff and kind of find out what we're about and what products we have.
Right. Don't forget, make your plans in November for this Sparkle event happening right here. Well, Dr. Cole, thank you so much for letting us talk with you, and I look forward to having you on again sometime when we have a little bit more time to talk.
That'd be great.
Thank you so much.
Right. Thank you, Judy.
Have you ever wondered why you cannot achieve a flat tummy like you had when you were a teenager? In spite of exercise, it seems like you're getting nowhere. It could be that you've had children and it's just impossible to achieve without having surgery. With a procedure called an abdominoplasty, we have specialized techniques that can repair the damage that has been done with the pregnancy or the weight loss. We can help you to achieve a flatter, tighter tummy like you had in your younger years.
Thanks for staying with us here today as we continue talking actually now with Dr. Reginald Sherrill. And Dr. Sherrill, it's a great pleasure to be back here with you today.
It's great to have you back, Judy.
Now, I know there's some things that are happening. I talked with Dr. Cole just a moment ago about the sparkle that's happening here.
Right.
But also there's some other exciting things that's going to be happening, and that's with breast augmentations. We talked a little bit about that a little earlier. Tell me a little bit about that.
Well, for breast augmentations, for many years since 1992, we only had saline implants that were available for breast enlargement or breast augmentation. About 2 years ago, they released silicone gel implants for breast augmentation, and they both are very safe implants. The saline implant is as safe as anything can be, in that if there's ever a problem, a lady goes flat, and she has no doubt as to whether something's going on. With silicone, because it is a cohesive gel, kind of like a gummy bear, so to speak, it doesn't deflate, and so people don't know whether that's intact or not. Most of them will stay intact for a long, long time. But the silicone gel has always been more expensive, usually about $1,000 more for a breast augmentation compared to saline. But our manufacturer has offered us a deal for our first 10 patients that come in. They can actually get silicone gel for the very same price as they could get a saline implant. So it is a savings of $1,000 for the first 10 patients that come in to have that done. Now, some people say, well, who would be the best candidate for a silicone gel implant? The people that would do best with a silicone gel implant are girls that are very thin, that have very little breast tissue. If you have a lady that has a B or a C cup, if you put an implant behind that much breast tissue, you really wouldn't know whether that was saline or silicone. It's going to feel very much the same. Now, if you're actually holding the implants in your hand, the silicone feels so much more natural, so much more real. And so for a lady that has no breast tissue, the silicone gel is going to be much more natural. It is a little lighter, and I'm talking just a little bit lighter. We're not talking a huge difference, but if you have the same size implant side by side, the silicone is a little bit lighter, and it generally has a tendency to create less wrinkling or rippling compared to a saline implant. But any implant that is used in the breast is not natural breast, and so it is going to have its own little peculiarities, to it, that people say, well, it doesn't exactly feel like normal breast. Well, it's not normal breast. It is different. But the silicone is a unique opportunity for people that feel that they would like to do silicone gel implants. It is available, for the month of October and November for ladies that want to use it.
Right. Well, I think that's very interesting that there is a difference between the two and the feel as well. But I think also interesting to know that they're different types for different types of people. It just depends on what size you are and et cetera, as you mentioned.
Well, the breast augmentation is still the number one thing that we as plastic surgeons do. Even in the recession and the difficult economic times, there was still a demand. And while the volume did go down a little, it was still the number one procedure that board-certified plastic surgeons did. This year there will be over 300,000 women in America that are going to be doing breast augmentation.
Right. What do you think is one of the major concerns when people are considering having an augmentation or choosing to have surgery? I know you're a board-certified plastic surgeon. There are things that you should kind of look for when you're making some decisions. Are expectations really one of the main concerns that people also should think about?
Well, we do think that board certification is important. Any doctor that has a medical degree can purchase implants and can put them into anybody that is willing to come into their office or into their operating room and have it done. And what we are trying to tell people, it's not just a matter of having an implant put in. You certainly want somebody that is qualified to do it. The other thing, you want a center that is qualified to do it. We were the first surgery center that was certified by the state, Northwest Georgia, and we have 2 certifications that we have to go by some very rigid standards. When you hear about some of the tragedies that occur in some of these cosmetic procedures, some of them are being done in people's homes.
Oh my.
Or you know, just a very limited facility, and you certainly want to make sure that your surgeon is board certified in plastic surgery, so you know that they've been trained. There are people that have just decided, well, I'm going to start doing this procedure, and over the course of many years they can certainly become proficient at what they're doing. But if they were to have a complication, they can't go to a hospital because they don't have privileges for those particular kind of procedures, and so the person that is having the problem has to be transferred to somebody else.
What about when you're debating on having plastic surgery or augmentations is what we're really talking about today? Should that be something that you really think about and talk with friends about, or do a little research on your own, or talk with the physician to know what to do?
Well, it's actually a combination of everything you mentioned. With the internet, you can get a tremendous amount of information just from the internet. You can go visit our website. We have a lot of information on that. We have nurse consults that are absolutely free. If a lady can call and just schedule a nurse consult, talk with one of my nurses. My nurses have been here a long time. My nurse has been for me the least amount of time, has been here for 15 years.
Oh,
and
my goodness.
Another one has been here 26 years. So they know these procedures very, very well, and they can give a lot of information. After that, you will visit with me, and so you're going to have a whole wealth of information before you finally actually have the surgery itself.
Okay, great. Now I want to just kind of, before our time is up, we only have about a minute left, but let's go over that information about what the actually manufacturers are giving the special.
Well,
or is it the distributors, I guess?
Well, our manufacturer, we're very proud of the fact that our implants are made by Mentor Corporation, and they're actually manufactured here in the United States.
Oh, okay.
The other implants are manufactured elsewhere. They are not manufactured in the United States. And while these implants can be very good and have very rigid standards as well, we're very proud of the fact that these are made in the US of A, and they're highest quality.
Great, great. Well, I want to say thank you so much for letting us come out.
Thank you for coming, Judy.
And it's been a pleasure, and we hope to talk with you again sometime in the near future. And as we get into the different seasons, it's great to have some information from the experts here, and we appreciate it so much again. Thank you.
Looking forward to your coming back.
Thank you again for being with us here at North Georgia Television. Until next time, I'm Judy Elliott with Dr. Cheryl, and we'll see you next time.
To advertise your business on TV, contact Elliott Media at 706-529-4237.